Hi, Prachi, can
Hello.
you hear me?
Yes, I can hear you. Can you hear me?
I can. Yes, I can.
Lovely. Amazing. How are you
I'm
doing?
good. How are you? Let me just let the
I
pen on my
just got
headphone.
done with the session. Lovely. All right.
Oh,
So, how is your day going so far?
my day is good. It's a bit hectic, but yeah, it's good. How's you? How are you?
Same. Shruti, I think we're sailing in the same boat. It's the adult life.
Right. That's amazing. Okay. Right. So I think just to begin with, we were going to talk about PTSD today. I think that's the topic of discussion.
Yes.
Yeah. So
All
just
right.
to
So,
begin with,
hmm,
yeah, I
go on, go on.
wanted to ask, what is PTSD? Like, is PTSD real according to you?
It's absolutely 100% real. So, PTSD is basically a mental health problem that is actually characterized by failure of, not being able to recover from a traumatic event,
Mhm.
right? And some people take good 6 months or so to recover, but some
Mhm.
people have to undergo treatment for the rest of their lives, right? So PTSD is very much real, and it happens after somebody has gone through a very traumatic event. Now, this traumatic event could be childhood abuse,
Right.
a very emotionally abusive relationship or
Mhm.
sexual abuse, right? Anything. So yeah, PTSD is real.
Also, it could take a huge toll on the person, right? Like, let's say they've been
Absolutely.
through like a traumatic event. Just to come out of it, it takes a lot out of a person
Yes. Yes.
emotionally, physically. It's draining.
It is. It is
So,
because it takes a toll on not only your mental health but like your physical health too, right? Because you're not doing okay, right? You have so many thoughts. There are
mhm.
flashbacks involved. You disassociate, right? Somebody who is actually diagnosed of PTSD, they have flashbacks, nightmares, poor concentration,
Right.
not getting good sleep and avoiding events altogether, right? To
Yeah.
avoid any sort of triggers. So yeah, it does take a toll, and it gets very it can be crippling. It makes your daily living quite hard. So
Right.
yeah,
Yeah.
it's difficult.
I completely agree with you. Also, if you had to say on the spectrum, who would you say is at
Hmm.
the risk of PTSD, like in everyday life?
Okay, so honestly, I'll tell you, Shruti. So when you go through DSM,
Mhm.
no, PTSD is mostly like it was a general view earlier in time that it only occurs or like people who've been in war, right, who are
Right.
veterans, only they go through this, right? But that's
Yeah.
not true. Anybody, absolutely anyone can be at risk of PTSD. It could be, yes, of course, war veterans. They are in a very difficult position. Children, right? People who have been through physical trauma. For example, some people, for example, I was reading the study, that there was this person and something happened to them. I won't go in detail because it can be triggering. And
Yeah.
they lost a body part, right? And after that,
Okay.
he couldn't really, he took a lot of time to accept that, now he doesn't have that body part. So yeah, anybody can be at risk of PTSD. It's not just limited to a certain population or certain geography, right? Anybody, absolutely can happen to anyone.
And it can happen at any point of your life.
Yes.
Like,
Yes. Yeah, absolutely.
right. Okay. And just to continue with the conversation, what do you think would be the symptoms of PTSD? Like, how could they occur? How could you just, tell apart from the people who actually have PTSD and what are the symptoms?
hmm
Like, how are they going through it? So,
All right. So this is something that I've noted down, Shruti, and I'll read point to point because I don't want to
yeah,
be like I want to tell people that this is real, right?
yeah.
So okay. Warning signs first is the behavior, right?
Mhm.
You tend to notice that there's a change in somebody's tone or the way they behave or their gestures. So behaviorally, you can find somebody with PTSD irritable, hostile, hypervigilant.
Mm-hmm.
They could have self-destructive behavior and social isolation, right? They tend to go in their shell. They want to be with themselves. So behaviorally, you can see that okay, they're not being as per the norm, you
Mm-hmm.
know. Then psychologically, flashbacks, right? Poor cognition. There's fear. There's severe anxiety. There's a lot of trust issues, you know.
Right.
Then mood, of course. If behavior is changing, if psychologically things are changing, then mood is also affected. So mood, there's loss of interest, right? They don't want to go out. They don't want to do the things that they usually like, right? There could be guilt. There could be loneliness. Um, they could be visibly really, really sad, right? There could be
Yeah.
crying spells. And other than that, sleep, of course, goes for a toss. Either, there's insomnia or, there's nightmares or they sleep a lot, right? And there's also emotional detachment and unwanted thoughts. So, yeah, I think for anybody to know that, if somebody is going through something, the first sign is like just observe, their behavior,
Yeah.
right? And their mood. And I think that speaks a lot that yes, something is wrong and maybe they would need help.
When you did talk about like, the sleep problems of PTSD, just delving into it like a bit more, would you say the nightmares could actually like be a repetition of what they say, the traumatic event that they lived through it? And usually people get it like in nightmares, like every day they dream about the same thing, so it haunts them continuously, right?
Yes, that's possible. That's quite possible. And of course, dreams have their own way of, like showing us things, making us feel certain emotions. And yes, so
Absolutely.
many times it could be about the traumatic event. Anything is possible in
Absolutely.
dreams because, it's I read in dream interpretation that dreams are the royal road to your unconscious. So unconscious mind is where we bury all our traumatic events, right? So if
Mm-hmm.
somebody if it is not actively or like when they're up and about, if certain thoughts are not coming out or there's some problem and they can't pinpoint because I've met a few clients and they were not aware that this is what they're going through, right?
Mm-hmm.
They took it as it's just that dream, right? So sometimes it's very
Yeah.
hard for people who are going through to also understand that okay, this could be a problem. So yeah, coming back to dreams, yes, whatever is an unconscious mind, it will come out in your dreams.
Right. Right. Okay. That was a perfect explanation of the symptoms. And so many a times, I think a lot of people just, confuse between acute stress disorder and PTSD. So, what would you say makes PTSD different from acute stress disorder? I'm sorry, Prachi, I'm not
Ah,
audible.
yeah,
Yeah,
I was on mute. My bad. Okay.
no worries.
So the difference between acute stress disorder and PTSD is the severity,
Mhm.
right? Acute stress disorder, the symptoms might just show up in a week or so, right? Or maybe like right after the traumatic event. However, PTSD, the symptoms might develop early, but they come on surface, they might take time, right? Another thing is that acute stress disorder, it usually takes to resolve it, let's say in 30 days, 0 to 28 days, right? But PTSD, for you to get the diagnosis as per the Bible of diagnosis in psychology, like the symptoms have to be continuous for a month or more than that, right? So the basic is, Shruti, is the severity. And if you look at acute stress disorder and PTSD symptoms, they're quite same, very strikingly same. So yeah, the difference is between the onset, which is when it starts, right, and for how long it goes on. That's
Okay.
the thing. And of course, yes, PTSD symptoms are, even though they're similar, but again, they could be they are actually more severe than the
So
symptoms in acute
you
stress
could
disorder.
say that PTSD is a bit more like critical and like a more difficult kind of condition rather than acute stress anxiety.
Yes, yes. But
Okay.
I think again, every mental health problem has its own, um areas where it just becomes very difficult. So yeah. But between the two, yes, I would say PTSD is far more tricky to handle, to manage.
Right. Okay. And talking about, since we did talk about the symptoms, we did talk about what PTSD is. Now coming to how to treat PTSD. Like, what would you think is the most effective for PTSD or towards PTSD?
Hmm. Okay. See, PTSD, since it includes a lot of severe anxiety, first and foremost thing is for people to understand or rather to learn self-soothing techniques, right?
Mm-hmm.
This is something that, again, I always mention grounding techniques. People are going to kill me,
I think
but again,
I've heard you talk about
right?
grounding techniques a lot. Yeah.
Right? Because again, I can't help it. They're scientifically proven and it helps in regulating the nervous system, right? So when there's a lot of anxiety not regulated. So first thing, just ground yourself. And it's not just grounding. You can actually help yourself by writing your thoughts down. You know, if it's not too uncomfortable to face your thoughts, then self-soothing is one thing that you can do when you're not in the therapy session, right? When you're not with your therapist. But when you're in
I
therapy, you
think
can go
I
for
go around, I'm so sorry for interrupting. I think
no
I
problem.
go
No
around with
problem.
the butterfly pats. I think if that's what
Yes,
you call it.
butterfly
Just
hug.
pat yourself.
Yes,
Yeah. I
yes.
think that really helps a lot. I don't know. What would be the one thing that like really works for you?
For me, okay, I have three. Um, it's bare feet walking. I like to walk bare feet,
Mm-hmm.
and I love the ice cube technique. It works like magic on me. Works
Ice
like
cube
magic.
technique.
Yes, so you can
How
keep
do you go about
So
it?
you can take an ice cube, you can keep it on your palm, and your focus will be on the sensation of your palm,
Mm-hmm.
right? What is it like? Is it cold? Is it tingling? However, name it,
Yeah.
right? But you do this till the time you're comfortable because ice tends to burn the skin. So if you can't put it on your palm, it feels too messy, you keep it in your mouth, right? You start chewing on ice. Again, focus will be inside your mouth. What is my mouth feeling? What is my tongue feeling, right? Is
Mm-hmm.
it getting numb? Is there some kind of sensitivity, right? Then, if this also feels too messy, just stick your hand in the freezer. This is what I do because I'm very lazy and I don't want to, clean things after the ice melts. So yeah, I stick my hand in the freezer and my focus is on the entire arm that is exposed, right?
Right.
Again, if this feels like a lot, take an ice pack, keep it near, keep it on your study table. Touch
Yeah.
it, feel, right? So that and double inhalation. I use this a lot when I am traveling and trekking and when I'm just mountaineering. I tend to, like really, because again, you're at height, you don't want to fall. So that when I do double inhalation, so you inhale twice and you exhale once. So that's it, right? And otherwise 4-7-8. So you inhale for 4 seconds, hold your breath for 7 seconds,
Mm-hmm.
exhale for 8 seconds.
I think
When
we
you
did
exhale,
try it. We
yes,
did
yes,
try these
yes.
breathing
Yes.
techniques together. Yeah.
So 4-7-8, also helps with sleep. So if somebody is having issues and you're getting like you're having a hard time just falling asleep, do 4-7-8 few times, laying in the bed, and you're good to go.
That's amazing. I think I should like teach the technique to like all my insomniac friends who do not get to sleep at all.
Brilliant. But yeah, coming back, Shruti, to the treatment in therapy, of course, I think it has to be eclectic, right? It has to be tailor made for the client. So again, there's CBT, there's EMDR, there's of course, clients can learn mindfulness, right? Meditation
Mhm.
helps a lot. Art-based therapies also help a lot, right? Dance movement or art and craft, right? Or maybe storytelling, story writing, theater. These are the few things that will help. And of course, medication, right? I know
Medication.
people are not very open to the idea of medication, but yes,
Yeah, the
medication
whole
helps.
stigma
It does
around
help.
that
Yeah.
medications will make them drowsy or lazy or they won't be able to get up the whole day, they'll be sleeping. That just keeps them from taking medications or
Yeah.
continuing with it, right?
Absolutely. And which is why I suggest clients that, be in touch with your psychiatrist, right? I am
Right.
pretty sure they're open to questions. You can ask them, what are the side effects? How long will it take, right? When can I see an improvement? What is the dose? And why are we changing it, right? It's ask. You're putting something in your body that is going to help you. Just ask. Be more
Yeah,
curious.
I completely agree. So by the end of it, if you think a person who's had like severe amount of PTSD with them, or if he's a PTSD client, with the right medication and the right treatment given, do you think PTSD is curable?
I think I don't know if curable is the right word.
Mm-hmm.
Well, why not? I think, yeah, but it takes long-term psychotherapy. So if somebody is I mean, the compliance is good with therapy, yes, of course, people do come out of it and they do lead a very happy and thriving life. So yeah, pretty much curable is actually the right word.
Yeah, perfect. So, I think we've almost come to an end of a conversation. There's
Yeah.
just like one last question. As a friend or as a professional or as somebody's own family member, how would you how can you support that one person with PTSD? Like how, in the most common ways, how can you support them?
Okay, by being kind, that's number
Mm-hmm.
one. That should always top the list. Even I think people need to be kind to themselves, right? Just be
Yeah.
compassionate. It doesn't cost anything. So be kind, and if you're noticing a change, as I said, in their behavior or in their mood, or socially, if they're isolating themselves or they're getting angry easily, whatever the change you see in them, right? Give them the space to come back to you, right? I'm pretty sure they'll come around and then they'll tell you why they behaved or they reacted the way they did,
Agreed.
right? And then I think the next thing is like listen, right? Don't listen because you have to reply, just genuinely listen, right? Validate somebody else's feelings. It's very important. I've seen a lot of times people are like, why are you sad, bro? It's not a big deal. Don't be sad. Come on, get
Yeah.
over, move on.
Don't
Don't.
cry about it. Don't crib
Yeah,
about it. You'll be
exactly. It's
okay
a
about
big
it.
no. It's
Yeah.
it's a big no. And if it's easy to imagine yourself in that. What if I am the one who's telling you, Shruti, that calm down. What if Shruti comes around and tells me to calm down, right? I will feel bad. I will feel hurt. I will be like, okay,
You're
my
not
experience, my
validating the other
yes,
person's
yes,
emotions.
yes. It's very, very important. And I think emotions have to come first because that's something that sets us apart from the animals,
For
right? We
sure.
have a high range of emotions. So again, just be a little mindful. I think it all starts with kindness, Shruti, honestly. Just be kind. You will be in that space where you can just be there for the person, right? And yes, reassurance. Tell them that
Yeah.
you will come out of it. And yes, remind them to be patient with themselves. It takes a lot. So yeah, be patient when you're around them and listen, like what do they really need in that moment, right? A lot of times we end up thinking that, okay, I know what the other person needs, right? Maybe sometimes we don't. And it's okay to ask the other person, what do you need? That's it. These are the few things, few little steps each day.
As they say, kindness goes a long way. That's
Absolutely.
I'm so glad I had this conversation with you and
Me
got to know
too.
so much about it. I think PTSD is not a really huge topic that is, spoken about. So I'm glad we had
Yes.
this conversation. And yeah,
Me
if
too. Me
anybody
too.
has any questions, they can just like put it down.
I think we got a lot of hearts. people are people are happy.
Yeah.
Or is it just
That's
a weekend?
uh-huh. Alrighty. I don't think
Hmm.
anybody has any questions.